Hello, Cincinnati! Thank you, College Park! Hello, Minnesota! Hello, Grand Junction! It's great to be back in New Hampshire. I am excited to be back in Montana. There's nothing like being back in the House of Labor. It is great to be back in Green Bay. We've heard scare tactics instead of honest debate. Too many engage in scare tactics instead of honest debates. So don't let people scare you. Because for all the scare tactics out there, what is truly scary, what is truly risky, is if we do nothing. Because for all the scare tactics out there, what's truly scary is if we don't do anything. For all the scare tactics out there, what is truly scary, what's truly risky, is if we do nothing. We don't feed on division and anger. We feed on hope. These struggles have always boiled down to a contest between hope and fear. Fight against the fear. This is not about politics. This is about helping the American people. You live every day just one accident or illness away from bankruptcy. One accident or illness could mean financial ruin. 1 in 3 young adults who don't have health insurance live one accident or one illness away from bankruptcy. I mean, think about adding the debt you already have for college, on top of that, another $10,000 or $20,000 or $30,000 or $50,000 worth of debt because you get sick. And all it takes is a single illness to wipe out a lifetime of savings. They are potentially bankrupt every time they get sick. I want you to remember one thing. There, but for the grace of God, go I. We've got to do something because it can happen to anyone. There, but for the grace of God, go I. If we don't act, every American will feel the consequence. If we don't act, and act soon to bring down costs, it will jeopardize everybody's health care. If something happens, they go bankrupt, or they don't get the care they need. A serious illness will break you and your family even if you have health insurance. If we do nothing, your premiums will continue to rise faster than your wages. Costs are rising far faster than wages. Premiums will continue to skyrocket, rising 3 times faster than wages. That will be you. 3 times faster than wages. Premiums that have doubled over the last 9 years and have grown at a rate 3 times faster than wages. Let me repeat that. Healthcare premiums have gone up 3 times faster than wages have gone up. It means premiums continuing to skyrocket 3 times faster than your wages. Premiums will continue to skyrocket. Your premiums will continue to skyrocket. They have gone up 3 times faster than your wages, and they will keep on going up. Spending on healthcare keeps on going up and up and up, day after day, year after year. Understand, even if you're happy with your healthcare right now, if you look at the trends, remember what I said, your premiums are going up 3 times faster than your wages and your incomes. So just kind of extrapolate, think about what does that mean for you 5 years from now. Healthcare costs will probably double again. Your premiums will probably double again over the next 10 years. They may even go up faster than that. If we let this moment pass, if we keep the system the way it is right now, we will continue to see 14,000 Americans lose their health insurance every day. We will continue to see 14,000 Americans lose their health insurance every day. If we keep the system the way it is right now, we will continue to see 14,000 Americans lose their health insurance every day. And that could be you. We're already seeing 14,000 people lose their health insurance every day. 14,000 people. More Americans losing health insurance, 14,000 every day. The deficit will continue to grow because most of it is Medicare and Medicaid. Our deficit will continue to grow because Medicare and Medicaid are on an unsustainable path. The growing cost of Medicare and Medicaid is the biggest threat to our federal deficit. That if we don't control costs on health care, there is no way for us to close the budget deficit. It will just keep on skyrocketing. The cost of doing nothing is going to be a lot higher in the years to come. Our deficits will be higher, our premiums will keep going up, our wages will be lower, our jobs will be fewer, our businesses will suffer. If we do nothing, more businesses will close down. It means more families pushed into bankruptcy, more businesses cutting more jobs. It means more Americans dying every day just because they don't have health insurance. We can't afford what we're doing right now. More people are going to lose health insurance. More employers are going to drop coverage or push more coverage onto their employees with higher premiums and higher deductibles. You will have not only the care you need, but also the care that right now is being denied to you only if we get health care reform. That's what we're fighting for. You will have not only the care you need, but also the care that right now is being denied to you only if we get health care reform. That's what we're fighting for. If I was a senior citizen, the thing I'd be worried about right now is Medicare starts running out of money. Medicare and Medicaid will go broke. Mark my words. If we do nothing, at some point, Medicare in about 8 to 9 years goes into the red. We'll have a choice. We'll either have to cut Medicare, in which case seniors then will bear the brunt of it, or we'll have to raise taxes, which nobody likes. So don't pay attention to those scary stories about how Medicare benefits will be cut. That will never happen on my watch. So don't pay attention to these scary stories about how your benefits will be cut. That will not happen on my watch. In fact, the folks who are making the accusations, they're the ones who've been talking about cutting Medicare in the past. I will protect Medicare. And unless we act within a decade, the Medicare Trust Fund will be in the red. For all the seniors out there who understandably are worried about Medicare, understand if we don't reform the system, in about 8 years, Medicare goes into the red. So if I was thinking about Medicare and making sure that I was secure, the thing that I would be most worried about right now is healthcare inflation keeps on going up, and the trust fund in 10 years is suddenly in the red, and now Congress has to make some decisions. Are they going to put more money into Medicare, especially given the deficits and the debt that we already have? Or are they at that point going to start making decisions about cutting benefits, but not based on any science or what's making people healthier? They're just going to start making it based on politics. And we'd have insurance regulations in place that would protect you from being scammed in the insurance market, which unfortunately a lot of people